So once we've had a cured Dupuytren's disease, how likely is it to come back? That is what Dr. Bachaoui is going to talk about just now.
Hello, everybody. My name is Rayan Bachaoui. I'm not yet a doctor. I'm a medical student at the Catholic University of Leuven, as well as a research fellow at Harvard Medical School, Brigham and Women's Hospital. Today, I'll be speaking about the likelihood of future Dupuytren disease intervention after initial treatment. Okay, these are my disclosures. So as you all know, Dupuytren has several treatment options. You have the surgical treatments, you have the injections, and recurrence has been studied, whether it is post-treatment recurrence in forms of any treatments necessary, or post-treatment recurrence in terms of any angles collected. But less is known about disease progression beyond the index site. And as you all know, involvement in both sides is not uncommon. So we try to ask ourselves the question, what about the other digits, and also, what about the contralateral hand? Very simplistically said, we tried to answer the age-old question of a patient coming in for example, a small digit fasciectomy and asking, hey doc, what are the chances that I have to come back for another treatment? So we queried our institutional electronic health records for demographics, and our inclusion criteria was any first-time Dupuytren treatment between 2015 and 2019, and our cutoff was a minimum of 1 year follow-up. These are the response variables we looked at, so any further treatment on the same digit, on the same hand but different digit, and on the contralateral hand. And in terms of explanatory variables, we looked at age, sex, smoking, diabetes, family history, ectopic disease, so Lederho's, Garrett's-Pads, and Peyronie's or La Peyronie's disease. And then pre-treatment contractures, initial non-treated finger contractures, dominant hand treated, and multiple digits treated. This is a very busy slide of our inclusion flowchart, but just to show that we started with 658 patients and then narrowing it down by our inclusion criteria to 341 eligible patients who have a 1 year follow-up. Then to get to the juice of the study, out of our 341 patients, 200 had collagenase injection and 141 had a surgical fasciectomy. In light gray, you can see that the percentage to get any further treatment was 42%. In dark gray, you can see that only for the repeat digit treatment, it was about a 26%. And then in black, you can see that for the contralateral hand, it was a 23%. And the lowest was the same hand but other digit treatment, about a 10%. You can see that disease beyond index progression is not rare. And if we subdivide it into the two groups, as I said, there were 200 patients who had Xiaflex done and 141 with fasciectomy. You can see that both of these graphs kind of follow the same trend. However, the biggest difference is that Xiaflex has a lot more disease treatment, repeat treatments. And another interesting thing is that both of these graphs follow the same trend. But the biggest difference is if you look at the dark gray color, you can see that for repeat digit further treatment, Xiaflex was almost double than fasciectomy. This is the same data shown in a Kaplan-Meier curve, where it shows disease progression, the probability of any Dupuytren treatment over time, where survival was defined as being treatment-free. And if we, again, sub-categorize it into Xiaflex and fasciectomy, you can see that Xiaflex had a higher amount. And also what's interesting is that when you look at the graphs itself over time, you see that there's a very steep decline in the first few years. And then if you look at around 6 years, there is a flattening of the curve, which suggests a window of Dupuytren treatment. And then, as I said, we looked at multiple explanatory variables. So for the same digit, we saw that procedure with Xiaflex having a higher likelihood versus fasciectomy. Multiple digits treated and non-treated contractures had a higher chance of a same digit repeat treatment. For the other digits, same hand, it was age, smoking, and non-treated contractures. And then lastly, for the contralateral hand, it was dominant hand treated, which actually served as a predictive variable, and non-treated contractures. Here I'd like to highlight the fact that non-treated contractures was statistically significant in all three of the groups, which I guess makes sense when a surgeon comes in and decides not to treat a contracture, and then the patient is more likely to come back. In terms of limitations, obviously this was a retrospective study, so we did not have the benefits of a prospective design. We had some incomplete demographic data. Dr. Brutus asked who of the surgeons records the Peyronie's disease, and in our study, about 40% of surgeons noted whenever there was an ectopic disease. About 6% of patients had ectopic disease. And we did not include needle aponeurotomy for the simple fact that in our time frame of 2015 until 2019, it was not very much done in our clinic. And then we had more than one surgeon, about 20. However, still, we still have a relatively big group, which shows some clinical relevance. And then I said a lot, and there's a lot of data in this study, a lot of graphs. For one, the main takeaway is that collagenase had a higher amount of repeat treatments. We knew that. But for two, to answer the patient question of, hey, what's the chances that I have to come back? So the likelihood of additional treatment at 2 years and 5 years for any subsequent treatment was 21 versus 29%. And then specifically for the contralateral hand, it was at 2 years at 16%, and at 5 years, about 1 out of 5 times at 21%. Thank you all for listening. I'd like to thank my mentors, Dr. Blazer, Dr. Earp, and Dr. Zhang, who sadly cannot be here today or still in Boston right now. And then also a special thank you to Dr. Lirif, who organized this event. It's a true honor to speak before you, and happy to take any questions.
Yeah, question?
That was a very nice study, and will add to the body of literature. You mentioned that you looked at the percentage of patients that had a procedure on the contralateral hand. One thing that would be interesting to look at is individual digits. What percentage of patients had a procedure on a different digit but on the same hand? Did you look at any of that in there?
No, you're right. It's a great thing to take away. Right now, we clustered any treatment on the other hand. So if you had an index procedure of the right hand small finger, whether it was the long finger or the small finger on the right hand, we just clustered that as contralateral hand. But we have that data, so it's something we could look at for sure.
Thank you very much.